Listen, Mr. Reed, before we get to you, I want to I want to speak with Dr. Levine.
You need to speak to many doctors.
I do. That's a very good point. From the Mohawk Valley Sleep Disorder Center at St. Elizabeth's Hospital. Doc, good morning. Thanks for coming on.
Good morning, Bill.
So, okay, we wanted to do a little bit of an update here on the sleep apnea and the mask and the CPAP and all that, and here we are.
Here we are. Well, just let me refresh your memory. We saw you back, I believe, in March, and we did a sleep study on you, and it showed that you demonstrated severe obstructive sleep apnea. You stopped breathing 168 times that night, and that calculates to an index of approximately 31 events per hour. So virtually every other minute or so, you either stopped or partially stopped breathing, which is considered severe sleep apnea.
Yeah, and I could feel it in the certainly very tired, but beyond that, every morning waking up with a headache, and you believe that's really the result of starving your brain of oxygen.
Starving your brain of oxygen, as well as the fragmented sleep that results from these interruptions in breathing.
And the other thing that, first of all, when I first went over to see Doc over at St. E's, I told him that I had this night terror type thing. We don't know if that's what it is, but anyways, these nightmares that turn into real life, where I literally get out of bed, I'm walking around. I mean, you had me padding the windows and making sure I couldn't fall out. I mean, you were very concerned about it. But I have to tell you that adding the mask, the CPAP machine, has significantly reduced any of that. I don't know that maybe it's happened once in the last 3 or 4 months.
Great. Well, what we did as a further update, we brought you back into the lab in May, and we applied the CPAP mask, and we virtually eliminated the severe sleep apnea that you demonstrated by applying that mask at a set pressure.
Yeah.
And you've been wearing it since, and as you've alluded to, there's many parameters that have improved as a result.
Yes.
Meaning the so-called, quote, night terrors, your morning headaches, your daytime fatigue and sleepiness. And also, importantly, and I expect a nice gift from your wife during Christmas, we've eliminated your snoring.
Yeah, she's really happy about that.
And that's generally, a major perk for most bed partners.
Well, it's the one thing that prevents those people many times from doing what they never said they would never do, and that is sleep in separate beds, in separate bedrooms.
That's right. And again, there's some people that complain that it does, affect intimacy. I mean, it is sort of bizarre sleeping with this device plastered to your face. But I recently read that you can certainly remove your CPAP unit a lot faster than your clothes. So again, if the need arises, I think it can be handled.
I see where you're going.
Okay.
Yeah, and I just for fun during relations, I just put the CPAP mask on beforehand. I'm like, check me out. Look at it, and it ends everything quickly. It's like,
well,
you're not doing
to each his own.
So yeah, that was going in the wrong direction. So, but I do want to say that I've tried the others, and I've had a lot of people really pushing the pillows. So I'm using the full mask, and the pillows are really these little pillows, tiny little pillows that fit over your nostrils. So it's much less invasive, and there's much less equipment. It doesn't look as crazy on you as the full mask. But I'm struggling with that. I haven't been able to kind of get that to work. I'm comfortable with the full mask right now.
Right. Well, what you're describing are there are various styled interfaces, meaning what type of device do we place on you to allow us to deliver this pressure? And there are various different styles. You are wearing what's called the full face mask. And that is generally used for people that are unable to keep their mouth closed at night while they're asleep. So you need to maintain a seal. So if you're able to keep your mouth closed, then we can use a nasal interface, namely the pillows, which are a device that inserts into your nostrils, or even a nasal mask, a smaller mask that is applied over your nose. The full face mask, though, is large and bulky. It allows you to sleep with your mouth open, and many people need to do that. And in the absence of the full face mask, you wouldn't be able to utilize the others because your mouth opens, and therefore we lose the pressure, and it becomes ineffective.
So can you just explain this for a second for people to understand? So you're having, and I've tried to explain this, but I don't know all the terminology. So I'm going to, in layman's terms, I'm just going to try to walk through it, and then you correct me and explain what's going on. So really what happens when I lay back, especially on my back, everything, there's a little something, a little flap that closes off the oxygen, stops me from breathing, or causes the snoring. The pressure, so this air pressure that's going through you constantly is putting a pressure in there and keeping that flap open, allowing the airway to be open and preventing the snoring.
Yeah, that's essentially correct. What's happening in sleep apnea is that the airways are floppy. What you're describing is a single site of obstruction, which is the uvula in the back and behind the tongue. But there may be more than one site of obstruction along the airway. So what the CPAP is doing, which stands for continuous positive airway pressure, is that we're blowing in a delivered amount of pressure that we determined to be correct on your last sleep study, and that's acting as what we refer to as a pneumatic splint. It's actually splinting the airways open to prevent the airways from collapsing.
Yeah.
And the reason why CPAP is 100% effective, with two caveats, assuming you're willing and able to wear it, is that it splints the entire airway. So if there's one, two, or an infinite amount of obstructions along the airway, this column of pressurized air will keep the airway patent. As opposed to an oral appliance, which is also a possible modality for the treatment of sleep apnea, it's basically more of a site-specific. In other words, if you happen to have an obstruction at the site where the oral appliance works, then the oral appliance will be beneficial. But most patients have more than one site of obstruction, which is why the oral appliance is not universally effective.
And like so many other people, this is what the story is like. My wife telling me I have sleep apnea. I'm telling her I don't. She's telling me I snore. I'm saying I don't. She's telling me that I stop breathing at night. I'm saying I don't. When you go in, Dr. Levine is like, you do. End of it. And it really has made things better, I have to tell you.
I'm glad. I'm really glad. And not only is there a subjective improvement in how you feel, but also there's also tremendous medical benefits.
Yeah.
I mean, sleep apnea is linked to heart disease, cardiac arrhythmias, hypertension, diabetes, dementia. So it has all these potential negative medical sequelae, which again, by treating, we've reduced those potential complications. All
right, Dr. Levine, it's over at St. E's. It's the Mohawk Valley Health System Sleep Disorder Center. Do I have that right? I think I do.
Mohawk MVHS Sleep Disorder Center, at St. Elizabeth Medical Center. Bill, if I can interject, there's a nice questionnaire that you might be interested in, your viewers and listeners may be interested in, that's been validated as a nice screening tool for sleep apnea. Basically, it includes 8 yes or no questions related to sleep apnea, and it's referred to as the Stop Bang questionnaire. And it's an acronym for stop. S is for snoring, T is for tiredness, O is for observed apneas, P is for pressure or high blood pressure, B is for BMI greater than 35, age, A is for age, which is greater than 50, N is for neck, which is greater than 16 inches, and G is for gender, which is male. I mean, you can look this up. It's a stop bang, and basically, it's a yes/no questionnaire.
All right.
And the higher the number you get 1 point for each positive stop bang that you choose. And the higher the number, the greater chance you have of suffering from sleep apnea. So if you score a 0 to 2, there's a very, very low risk that you have sleep apnea. If you score 3 or 4, there's an intermediate risk, and 5 or above, there's a high risk. So if you take that questionnaire, you can sort of gauge as to the likelihood as to whether you suffer from sleep apnea.
Right. And neck size is really important.
Neck size, 16 inches or 17 inches in 16 inches in females, greater than 17 in males. Increase your risk is a risk factor for suffering from obstructive sleep apnea.
Again, what number do they call if they have an interest over there?
801-3484.
And the ladies could call for their man.
Bring them in.
Okay, cool. Dr. Levine, thanks so much.
Sure. Good luck.